All right, thank you for staying with Daybreak. We're still talking about the COVID-19 and the political side of it as well. Dr. James Nyikal, SEME Member of Parliament and member of the Health Committee, is with me here. Senator Sylvia Kasanga, the Chair, Senate Ad hoc Committee on COVID-19, is also with us. Steve Ogolla, Advocate of the High Court, is also with us here. And John Kagushia, Nyeri County Assembly Speaker, is still with us as well. Your views are welcome at Trevor Mbija at Citizen TV Kenya. Use the hashtag Daybreak. And Dr. Nyikal, let me come to you. You mentioned when we started this conversation that you're not satisfied with the use of the money put aside. You're not satisfied with the process of procurement. Who does the buck stop with from the National Assembly's perspective?
The buck actually stops with the Ministry of Health.
Okay, we seem to be having a bit of a challenge there with Dr. Nyikal. Let's try and fix the sound and then we'll get back to Dr. Nyikal in just a bit. Honorable John Kagushia, I am perplexed when you say that the County Assembly's Forum could not find out how the money was used. This essentially falls within your docket. Where does the problem lie? Is it that the executives were not giving you the political goodwill to access these funds or even know where these funds are being used? Or is it simply collusion between the county assemblies and the executive in the counties?
Well, Trevor, I'm not the spokesman of County Assemblies Forum. I probably can only speak for Nyeri County, where we decided, you know, these things you have to be very, very deliberate and very calculative. We decided we are going to offer leadership in fight against the COVID-19. And that is why we came up with a bill. And then we came up with the ad hoc committee. We came up with a report. We came up with recommendations, 15 recommendations, which we were able to pressure for the maintenance. Did not get it. Today we are following up the recommendation.
Okay. Let's fix our, hold on 1 second on that, hold that thought in just a bit. We seem to be having a bit of internet challenges there. Let's fix that first before we get back to the guests who are joining us on Skype. There seems to be some issues there. But Steve Ogolla, let me come back to you. What would it actually take for criminal prosecution? Because Kenyans have been saying we want to see people being taken to jail. What would that take?
Well, Trevor, the first thing that would happen is that if you look at the Public Procurement and Disposal Act 2015, it lays down the procedure for pre-qualification and tender processing. Now, if you award tender to a company that has just been newly incorporated, when the law requires that the company should have demonstrable experience, you know, in terms of the technical capabilities, it should have demonstrable experience to provide that which it seeks. It need not necessarily in terms of provision of PEPs, but similar type of experience. So it will be curious. It will be a very difficult position for for KEMSA leadership and the CS to explain how these companies that were incorporated, sometimes just 2 months before they were awarded the tenders, actually got these tenders. They're not in the business of medical supplies, but they were awarded tenders to provide these PPs. I think that is the first question that will be answered. The other question relates to direct procurement. You know, even if you're doing direct procurement, the law provides a pathway to it. There has to be a resolution and a decision made why you are doing direct procurement. Is it the timelines, or is it because there's only one supplier who can provide this? So once these questions are answered, if there are gaps, then charges will be preferred. Again, also, in terms of the funds received, if you paid, you know, you may have procured procedurally, but if you paid over and above public money, over and above the market rate, then you may be accused of misapplying or misusing public resources. And another maybe an offense can also emerge from there. So usually this kind of corruption-related offenses revolve around failing to follow procurement laws, leading to loss of public resources, or implementing a project without prior procurement planning or without prior planning, which means even prior planning within the shortest time possible. In the circumstances, can you justify your action as having been founded in the law? Now, those ones, you're looking at KEMSA leadership. But why I'm also blaming the CS, you see, the CS has the overall political accountability at the ministry, because then you would ask, who are the companies that have been pre-qualified? He's not involved in the pre-qualification, but he can ask, who are the companies that have been pre-qualified? Who are these people? What is their statement of experience? What is their financial and technical capabilities? and then he can say, no, I sense something is going on.
Yeah.
The CS is not whistleblowing. The people that are whistleblowing are other institutions. I think in terms of accountability, if you are the CS and money is being allocated the ministry to fight the pandemic and is being given to people who do not qualify, do not have the technical capacity to provide this equipment, and we are also paying over and above the market rate, I think it is proper to ask the CS to step aside or even to be fired.
So at this point, there's an issue here, and I want to bring in Senator Sylvia Kasanga on this. And Ogolla is talking to me about what it would take for prosecution. Does the argument of price fluctuation hold based on what you have seen across the counties when you're traveling there as the ad hoc committee? There's the argument that at the time, the prices were different because of the law of supply and demand. Were you satisfied with that argument?
Trevor, no, we were not satisfied with that argument, because even in the first instance when we raised this issue at committee of pricing, it's because the frontline workers had brought us comparisons of pricing from other sources for us to look at. And then the question then arose, why is it that KEMSA is talking about, the inability to get these products at good prices, considering the doctors brought price lists of other suppliers who could, supply at those good prices. That one came out very clearly. And Trevor, because I know you've been following very closely, the Auditor General's first report, her preliminary finding of the procurement process, she did categorically qualify that the whole scheme was supply-driven as opposed to demand-driven. So you can see they were trying to reward themselves by these pricing. So we were not satisfied at all. And we were, the Auditor General's report was very clear when it came to that. And, we were justified in our anger.
Yeah.
And the frontline workers were also justified by telling us, by bringing it out to us that there was a problem with the pricing, Trevor.
Yeah. Senator, having traversed the counties during the time when you were probing this issue, do you think we are better off now in terms of infrastructure after having pumped in the billions of shillings in the health sector?
Unfortunately, Trevor, we only visited 5 counties. 5 out of 47, I can't say is what we can use to qualify that, to answer you that question very well. But we do have a report from the Ministry of Health that was presented to our committee, where they were able to rate, the counties as per how they had performed with the funds that they had taken down. And a lot of the counties, like you've had, I think one of the members had said in the forum here, has mentioned that a lot of the counties had not fully utilized their funds, and they still remain unutilized. And at the County Assemblies Forum report that they brought to us, they did tell us that they felt very strongly that the impact on health, that these funds that have been sent to the counties, the impact on health should have been very significant by this time. And they reported to us that they were disappointed that they could not feel that impact. And that is something we have to rely on heavily, because they are the ones on the ground, they are the representatives of the people at the county assemblies. If they tell us that they cannot feel the impact of the funds that were sent down to help with the health systems, then we have a problem. And I agree with them, because by now we should have had a significant impact, Trevor. With all the money that has been sent down, there should be a significant impact on health sector, especially level 1, 2, and level 3, because level 5s were funded separately. And level 4, I think there's some cooperation that happens there. But for level 1, 2, and 3, we should have seen something really significant across this country. I think we should have seen, in fact, almost like a complete overhaul, like a new breath of fresh air when it comes to the health sector. So that is lacking. The County Assemblies Forum did report that to us, and we will rely on it in our exit report, in as much as we only visited just 5 counties.
Okay.
There were some good things, and I think the president's speech yesterday, he did say, let us celebrate some of the good things. And Trevor, I think one time when we were talking on this platform, I did say we went and found a few good things. I think when we visited the Coast region, we did find a few good things where we could see a lot of cooperation of county government and what do you call them, and private sector to expand their healthcare system and tackle COVID in their own ways. And we were happy about some of the wins that we saw. Okay. But largely coming from CAF, you can see there's a real big problem.
There's a gap there. Okay. Dr. Nyikal, sorry I had to cut you short earlier on. We had a bit of internet challenges. If you're back with us, you are finishing your thought on who you think should be held culpable.
I said the ministry will be held accountable on this because they're actually the leader of the team in the National Response Committee. This is a health matter. So really, it is upon them to actually guide that team. But I want to tell you, Trevor, the basic thing that we are actually seeing in health now, that COVID has just actually highlighted more, is the lack of proper coordination between the national government and the county government. And you can see this was in the financial systems. The money went it, and actually a lot of money has not used, as my colleagues there said. Even the payment of staff, the money was just for 3 months, and they have been paid the allowance that they need, and they're not sure what's going to happen after those 3 months. The parliament even gave 300 million for purchase of masks for people who could not afford, that may have been used now the schools are opening. Now those masks up to now have not been used. And when we talked about the distribution that was expected to go of PPEs, for example, to go to counties, we found that the system was not actually working properly. In Kakamega, in Kisumu, we visited those. Even in Mombasa, we did find the distribution system is not working. So the problem we are having is the problem of coordination. The problem, again, is another procurement. And I think in procurement, KEMSA, which is under the ministry, will actually have to take flag, the CEO, and definitely the CS and the principal secretary. Although in our record, what we found, it was definitely some communication between the KEMSA CEO and the ministry that indicated that there was some involvement that didn't let the process move smoothly as expected and in accordance with the law. So I think the ministry cannot escape this. Let's say the ministry has done some good work in sensitization of the people, but there was a flag there. But maybe there's something that looks like we may live without saying. What is happening now? To me, that is a major concern. The issues of the monies that have not been used well, the issues of procurement that have not been done properly, the issues of distribution, and we have said we should really take the flag for this. What about what is happening now in the populations of people adhering to the COVID regulations we have in place? What is happening? The numbers are rising. But when you walk around, you don't see the adherence. You don't see people wearing masks. There's a bit of hand washing, but when you go in public places, you don't see it. When you go to hotels, when you go to even funerals are still going on. Public meetings are still going on. I think that's an area that I thought we'd talk about. That is going on. At the same time, yes, that is a surge. The numbers are rising. We started with about 3% positivity rate, and for 2 weeks, and then we said, now we can relax. Since we relaxed, they are going up. It went up to the highest, I think, was 20. Then it's now about 14, and it has been hovering around 10. The numbers of hospitals are increasing. So that is an area we should look at. Are we adhering to the guidelines that we have put up as a country?
Dr. Nyikal, now that you brought this up, can you relate this surge in the numbers of COVID-19 directly to the relaxation of some of the protocols that were put in place?
Scientifically, you have no other way of explaining it. We can't just say it happened, because when the guidelines were strictly adhered to, we actually saw results. Now you have relaxed and you are seeing the numbers going up. How else would you want to explain it? I'm not saying we should go back to the knockdown and the severe restrictions, but even as we have relaxed, I think there should be still some measure that ensures that public meetings, people adhere to that. In funerals, people adhere to that. In weddings, people adhere to that. In hotels, people adhere to that. And in public transport, people adhere to that. I don't know what your experience is, but mine, it literally just opened.
Gogola, you want to jump into this?
I think it's a curious development.
Yeah.
That the surge in our numbers, COVID infections, is going up in a manner that is identical to the global West, because the global West is experiencing what you may consider as a second wave, and Kenya is also experiencing what looks like a second wave. Is it just a coincidence, or is it in anticipation of more funding? You know, these are questions that you may think that we're asking them for the nuisance value,
yeah,
but actually they may have greater insight other than just management of COVID, because we know money has been lost. Money has been lost, and then because of the frustration and the backlash the government faced following a series of interrogations and questioning around the appropriation of money, we started seeing the numbers going down. But then if you watch the pattern in Europe and even in the US, they have been concerned that although they have not relaxed their measures there in abroad, but the numbers have been going up again. Then suddenly we've also seen Kenyan numbers also going up. Is it in anticipation of something, or is it because of management? The problem now is we may never know whether the surge in our numbers is a direct consequence of a relaxation of the measures, or it is just timed, a perfect timing to match the global surge of the second round of infection. Now that is the kind of distrust government faces when it doesn't account the people, the manner in which applies its own funding. But there's a point there I think we have not attached to it. These suppliers, Trevor, and I think I'd like to maybe question all Kenyans, if you're doing government with business, I mean, if you're doing business with government agencies, you have to be very careful how you come in, because questions will emerge. If you could be charged with fraudulent acquisition of public property, yeah, if you are tendering for work, knowing very well that you have no capacity to deliver, and then you get that work, there's a moral and ethical question, which can also translate into a legal question, whether really, when you're getting this tender, you have the capacity to deliver the tender, the procurement, to deliver the supplies.
Capabilities on both
yes,
sides.
There could be, I'm saying, yeah, it is possible that if people are going to be charged, officials at KEMSA may be charged, and then also the suppliers may also be charged for being roped into a scheme, yeah, to defraud government of public resources, because you must answer. And we want this ethical conversation to be deepened within our communities. Yeah. When you see a government floating a tender, can you say that you have the capacity to respond that tender in a perfect setting without being helped, yeah, by a certain quota? So we may see people who supplied, and those questions will emerge. We want to know these companies, yeah, who are just newly incorporated, what gave them the financial, technical, and moral stamina, yeah, to bid for this work, knowing that they don't have this kind of capacities. They may find themselves in court over and above the, yeah, KEMSA officials. Okay.
Kagusha, let me bring you back in. And I know you mentioned that you're not speaking on behalf of CAF, but as a County Assembly Speaker of Nyeri, and I know you speak to your peers, where does the gap lie? What is the problem there? How come they're not able to hold their counties accountable, so to speak?
One of the things we found when the COVID-19 came, and I think Dr. Nyikal has properly put it, the lack of coordination between the national government and the county governments. To some extent, I felt like it may not have necessarily been just the lack of coordination, because like the county governments were already receiving a bit of funding from the national government. But I believe that a lot of county governments cowed in and kind of dropped the guard and decided to wait on the national government. And I kept arguing, and I remember even publishing an article in one of the newspapers urging county governments to take charge of their counties and to remember that they have been elected by the people as governments. They are not half governments, they are not quarter governments, they are governments just like the national government. We can't just be a government when we are talking of sharing of resources. When we have challenges in the country, we also must rise to the occasion and offer leadership and come in strongly as a county government to really take charge and take control and give direction to the people. You find like the issue of testing, most of the counties did not come in strongly on providing leadership in terms of testing. Until today, even after receiving so much funds, counties have still been collecting samples and sending them to Nairobi. Yet, we as county governments should be able to liaise even with other international organizations that do have capacity to capacitate the counties. And we also have the funds and the capacity to, and the laboratories even to kind of beef up and improve so that we can be able to do the testing. So there was that lack of giving leadership from the county government. And I dare say that because I'm in the counties and I know for sure, a lot of county governors politicized this issue a little bit too much. So you could find that a lot of governors were happier with distribution of sanitizers, with distribution of food, with the distribution of masks. Most of the governors went for those easier tasks, which would give political mileage, than going for the jugular, going for the more sophisticated and complicated issues like contact tracing, like testing, like looking for funds to do oxygen plants in the level 4s and level 5s. We found that was not really happening. The other thing is that executive arms of government a lot of times want to stay away from accountability and being oversighted. So you'd find that since the money that was provided, except for being appropriated in the county budget, a lot of this money was coming to the county executive without proper involvement of the legislature, like what Senator said. So you'd find that the money which was received here in the county government of Nyeri, 124 million, we didn't get to know that the money has come. We didn't get to know how much money had been sent until when now we got out of our way to go and do further interrogations and investigations. And that's when now we found that money had actually come, so long time ago. And this, like, for example, was in June. And of course, that lack of involvement of the legislative arm of the government was removing the aspect of accountability and oversight, which is constitutional. And unless now you came in a little bit more tactfully and creatively, then as a county assembly, you are to be left behind. And of course, I know until today, we could be having county assemblies that may not have had a clue of what happened, may not even know how much money was ever received in their counties, may not even know how that money was being used or was used. And so there will be need for the Auditor General also to come in to the aid of such kind of county assemblies and also county executives, so that we can be able to know much more. But on our side in Nyeri, we are expecting that every single shilling that was sent here, the 124 million that was sent from the national government, will be put and will be taken to proper use. And a very important thing that also has come up from this is that there is a serious structural problem and systematic problem with the supplies from KEMSA. You find that supplies which have been coming from KEMSA, and this has been has been happening for a longer period of time than the COVID period, is that there has been inflated pricing from KEMSA as a supplier to the county governments. I don't know why the county, the Council of Governors has not been very loud about this. And I think sometimes we need to borrow a leaf from the former governor of Bomet, Isaac Ruto, where he was very vocal about the mess, the medical equipment services. We need to have governors also coming out a little bit more strongly, for example, to pressure the Senate to help us with reviewing the KEMSA Act, which forced all the counties to purchase and to take their supplies from KEMSA. These need to be liberalized so that the person who supplies quality and affordable medical supplies then can be able to supply, other than relying on an extremely overpriced drugs from KEMSA, which sometimes also are not delivered in good time, even after payments are done.
Let me bring in Sylvia Kasanga on this, and I want us to wrap up on this issue of COVID-19 rising cases and then get into the BBI a bit. The report has not been released, so we'll just talk about the preliminaries just a short while, about 20 minutes, just to hear your views on this. But Sylvia, as you wrap up this discussion, where do we go from here now? So the term of the Senate Ad Hoc Committee on COVID-19 is coming to an end. Now we are seeing what people have termed as a spike, a second wave, but there's some level of fatigue that has come in with COVID-19. People no longer even wear masks. Social distancing is a mirage. Is it time that we change the messaging around COVID-19? Because when we started also, there was a theory that it only affects people with pre-existing conditions or people who are vulnerable. But now we're seeing that even the younger people are dying.
Yeah, Trevor, in fact, I was just going to add on to that when you asked the question earlier, and I think Steve Ogolla also touched a bit on it. Of course, there's a fatigue. And history has shown from other pandemics that human beings, the way we are socialized, you will not remain in containment for long, and these new habits are difficult to inculcate in our daily lives. So the fatigue definitely is there, and Kenyans wanting to go back to a normal that they identify with, as opposed to a new normal. That is definitely there. But I think largely and honestly, Trevor, is the issue of trust, the lost trust. Like Ogolla has said, the lost trust is playing a very big key issue here with how Kenyans are reacting right now. The perceived loss of funds the fact that, you know, you're hearing all sorts of stories when the CS comes on TV, on national TV, and says that there are thugs in Afya House. When you hear there are people who have benefited from COVID funds in form of billions, when you hear of governors who are being mischievous when it comes to oversighting, when you hear about stories like we've had, not even just stories, we've had cases being brought to us where some whistleblowers in the counties are saying this governor has not bought ICU beds, and when you go there to ask about it, you know, they take beds from a private hospital and, you know, put them in where you're going to inspect, then you know there's a problem. And Kenyans, of course, are looking into these things and they follow very closely, and they will lose trust and they will say, no, these people are just trying to make us do these things because they want more money to steal from. So the lack of trust has played heavily on this. And we listened to you, Trevor, the other night when you had some experts on TV, and they said, you know, it's not a question of a second wave. I think it's a question of the same wave only coming in differently in the counties, because now we are seeing outside Nairobi and Mombasa, it's rising as it was expected once, you know, the lockdowns had been released. So really, it's now for Kenyans to realize that this thing, we have to handle it differently. And even now the Ministry of Health has to message it now a bit differently. That fear they had used in the first in the first round of containment is now not going to work. You're not going to lock Kenyans up again. Already as it is, Kenyans have really suffered financially, emotionally, mentally, you know, mental health issues. There's no way another lockdown is going to work. So the messaging now has to go in a different way. We have to now realize and tell Kenyans, personal responsibility is the most important thing. Even as we are trying to go back to a normal that we shouldn't be going back to, we are exposing those who have pre-existing conditions, and now we don't know who else is going to get. The disease is evolving so fast that even keeping track of its, you know, its behavior is becoming, and it's looking like a challenge. So I think Kenyans need to realize this and take personal precaution. And we're waiting to see how the Ministry of Health is now going to, you know, change its messaging, because it must change its messaging. It can't approach this issue the way it did in the first instance. And I'm really hoping that going forward, that the ministry will do things a little bit more differently. The issue of governance and accountability, they have to really look into it. That one, like has been said by the speakers here, we have to look into it. And then the support that the national government, the Ministry of Health, is supposed to give the county governments as part of their coordination, as part of ensuring that the county governments have everything that it takes, they need to speed that up. You know, Trevor, one of the issues that we did come across is like you find ICU beds in Kilifi, for instance, but there's not a single staffer, there's not a single ICU nurse or doctor in Kilifi County. And what the Ministry of Health needed to do is either send experts there as the counties continue to train as part of now, you know, what they need to do to make their healthcare, you know, now improve. Because what was the point of, you know, buying ICU beds when there are no, you know, critical care staff? So those are some of the things that the ministry needs to, you know, speed up and improve on as we move forward.
All right. Dr. Nyikal, very briefly on COVID-19, what are your final remarks on this before we switch gears?
My final remarks are, one, the people may be fatigued, but systems should not be fatigued. If people are fatigued, the system should react, change the messaging, change the strategies, but we must hold on. There is also this suspicion that this is rising at the same time as it is rising in other countries. But if you look at it, even other countries in Europe also tried to relax the guidelines, and it is the same time that it has come up. So it's exactly the same thing happening here that is happening in other countries. And the other thing I must say, there must be coordination between the national government and the county governments. When you hear of, say, you have ventilators without staff, that is clearly a matter of coordination. Because when you are going to buy, you should say, I'm buying, and these are the people that are going to work there. So that money is locked. You cannot pay staff, the little staff you have machines that are not being used. So again, that is a matter of coordination. So my final remark is that we should treat COVID as with the seriousness at the beginning, even if we change the strategies and the messaging, but the seriousness must remain. And the guidelines we put in really have to be adhered to. Once we sort out the problems of management and integrity and so on, we must go on with the management of the COVID.
Kagusha?
Yes, I have a point. As we talk today, many counties still remain incapacitated in terms of handling critical cases, which was and remains still one of our areas that as an ad hoc committee in Nyeri County Assembly we have been looking at. And why is it that the county governments and counties are not able to look at the critical cases or are not able to handle critical cases? Because most of the hospitals still do not get piped oxygen. At least in Nyeri County now, we are happy that we will be having piped oxygen in at least 2 of the level 4 hospitals. That is being funded through the 124 million. And then we are hoping that we are going to get much more money, which will come through the donor funding that was also promised through the COVID-19 arrangement. But a lot of counties still remain without that capacity. And I still think there is hope, and I would want to urge the legislatures at the national level, at the Senate and the National Assembly, and also at the county assemblies, to come a little bit more deliberately and forcefully to still look at this money which is still not spent, because county governments have not spent their money. So there's hope that this money which has not been spent can still be spent in the right way to ensure that we beef up the infrastructure so that we are left better and stronger as county governments and hospitals than we were before. Lastly, there is the issue of looking at legislation that has to do with healthcare in Kenya. This is something that we need to seriously address through the BBI process, because we can continue with this system the way it is today, because it is not functioning, it is not working. You find, like what the Senator Kasanga has said, you have equipment in some of the county governments that are not being used. Why? Because we do not have trained staff to use those equipment, like the ICUs. Now, if all these health workers were put under one umbrella body, which is the Health Service Commission, then would probably be managing the issue of staffing and the issue of capacity and skills in a more centralized manner. I know the Council of Governors has been a little bit more resistant on this, and I know there is a possibility in the BBI. The compromise has been coming up with the Health Service Council, which to me will be, again, waste of our own imagination and creativity as a country. We need to face the facts and come up with a Health Service Commission that is going to address this issue. A lot of counties still remain without doctors because doctors have gone to Nairobi for masters and for further training, and they're still being paid by their counties. But can you imagine if all these doctors were being handled from one central place, like the way TSC does with the teachers? Then there will be more coordination so that all the counties kind of remain balanced, all the hospitals remain balanced. And so I highly advocate, as we are looking at the issue of the changing of the law, we must also address some of these challenges so that we are not only addressing what is politically good for our 2022 politics, but we are also addressing what is good for the public in terms of bringing a change into a system that has completely failed in the last several years when we had devolution. All right, let's bring in Steve Ogolla on this very, very briefly before we talk about the BBI.
I think, Trevor, the lesson to learn is that government has failed yet again to inspire confidence in the way in which it applies public resources in times of crisis or pandemic like this. People were joking, that this pandemic will be an opportunity for people to become millionaires. And as sure as day succeeds night, we have had overnight millionaires, we have had proven instances of misapplication of public resources. It's no longer rumors. The Auditor General spoke to it. You can see the Senate Ad Hoc Committee are already agonizing, and the County Assembly is also agonizing over the same. I think government has to do better. The only thing that the government has done well, I think in terms of access to information, government did well. Unlike Tanzania that declared that the country COVID doesn't exist, a very absurd position to be at, there's some gains, but there are also the usual anxieties of Kenyans that where there's a crisis, money will be lost. I think we have still lost money, and government must reflect and act differently. For that reason, CS Kagwe should step aside, or he should be fired, because he spoke about the Minister of Health being, sort of having been filled with thugs and crooks. I mean, if he knows that there are thugs and crooks at the Minister of Health, he should have done something about it, or at least said something, what he thinks should have been done about it. But you cannot approbate malfunction and then not take responsibility. Okay.
Let's take a quick break here on Daybreak. When you come back, I'm deliberately limiting the time for BBI because we all don't know the final report and how it looks like. So we are mostly just pontificating, but the president mentioned something about it. So we are going to react to what the president said. Dr. James Nyikal is still with me, Seme, Member of Parliament and Member Health Committee, Sylvia Kasanga, Senator and Chair, Senate Ad Hoc Committee on COVID-19, Steve Ogolla, Advocate of the High Court, is still with me, and John Kagusha, Nyeri County Assembly Speaker, is also with us. So we're taking a quick break here on Daybreak. We'd like to see your views as well at Trevor Mbija at Citizen TV Kenya. Use the hashtag Daybreak. When you come back, It's time for the BBI, or like they call it, Reggae is back.